Bernaldez, and today I'm going to perform the fecal urinary catheterization. So, urinary catheterization is a process in which the catheter is inserted to the bladder to collect or drain the urine. So, first thing first is to check the position order for the catheterization, and of course, introduce yourself to the client and verify the client identity. Using the two identifiers, establish good report to the client, and of course, provide the client the opportunity to ask for raise for his or her concerns, how the clients and how she would like to be called, and then of course apply gloves as necessary, and do hand washing to prevent the spread of the microorganisms. So now, put the equipment to the tray ahead of the time will prevent the contamination, such as first the tray of catheter, in which includes the urine bag and catheter and clean gloves and draw sheet, sterile water, cotton balls, antiseptic, forceps, and lubricant. At ease that explain the procedure to the clients, of course, and how she participates during the procedure. Ensuring the client's comfort and privacy by screening or closing the room, then position the client in the dorsal position to have a good visualization of the meatus is essential for introduction. If the catheter and the cavity will aid the flow of the urine, then the bladder is higher than the end of the catheter. Equipment needed, the tray of the catheter is syringe, clean gloves, urine bag, and catheter, and draw sheet, sterile water, antiseptic, cotton balls, forceps, and lubricant. So, good morning, ma'am. My name is Kristen B. Bernaldez. So, may I know your name?
Nadine.
Okay, so when is your birthday?
November 12.
So, it's okay that I'm going to check your wristband. So, what do you want me to call you?
Everything you want.
So, Romuline, the procedure that I would be doing is that I'm going to perform the procedure of the urinary catheterization. So, this is based on the position order. So, this will help you to relieve your urinary tension. So, of course, I will touch some part of your body. That's okay with you?
Yes.
So, as you can see, the curtains is closed so that there will be no other people who can see us, and of course, to provide you a privacy. So, do you have any clarification or concerns? Okay. Not so far. We will going to start the procedure. So now, let's treat the patient, exposing only the area used for the reason that embarrassment and chillness we can cause the patient to become tense. So tension can interfere with easy introduction of the catheter and direct lights for visualization of genital use to no less. Let's start. So, open the tray and arrange the equipment for the convenience and according to avoid the contamination of sterile items. This is dray for us to, in, to increase the speed of the performance. Now, use the sterile forceps to cleanse the area using the cotton ball with betadine. This is done because the true cleansing of meatus and the area of surroundings, it reduces the possible introduction of the microorganisms into the bladder and open the set. Put the gloves to prevent the spread of our to the clients and of course put in the eye shape. So now after cleansing the genital area, I'm going to change my gloves because my glove is already contaminated. So now connect the catheter to the urine bag. So now let's inflate the balloon to the 15 syringe water using 15 to 20 cc syringe, then secure the indwelling catheter by tapping it to the patient tie, and allow some slap of the tubing to accommodate the patient movement. So now, let's do the aftercare. So of course, afterwards, we need to place the patient comfortably and clean at the equipment truly immediately after use because secretion, lubricants, substances are removed more easily when they are not coagulated. Patient Romuline is 41 years old, female, was performed catheterization. The time started at 9 a.m. The color of urine is clear.